Warahmatullahi wabarakatuh. Thank you for listening to this webinar. This webinar is aimed at those who are planning on delivering a BIMA health awareness session on understanding cancer screening in the coming weeks at their local mosques and community centres. Alhamdulillah, we have had over 80 healthcare professionals register an interest in delivering these sessions across the different parts of the United Kingdom. The session is divided into two parts, this webinar. First, I will talk about BIMA, our vision, mission and history, and how to register with us, and then tips on presenting this presentation. This will be followed by a presentation and discussion by Marion from Cancer Research UK. So BIMA, so the first slide, I'll move on to the first slide. BIMA is British Islamic Medical Association, and it's a national organisation of healthcare professionals based across different parts of the United Kingdom, with teams in Scotland and down to London, Wales and other parts of the country. We are a volunteer-led and run organisation with a variety of healthcare professionals, ethnicities, career grades, specialities spread across all corners of the UK. We've lots of different events from life. We've done lots of different events from life support training to thousands of people attending over 70 mosques last year to learn basic life support, training our peers in how to prescribe safely for patients fasting in Ramadan, representing Muslim staff at national policy meetings to allow women to wear hijab in operating theatres, providing career orientation to hundreds of young trainees and students, and much more. Our mission is to inspire our members to unite in the service of our patients and profession. How can you help and get involved? Register with us and make yourself heard. Join the different regions, brainstorm ideas to help it grow. Join our national programs and be part of something bigger. And you can join by emailing recruitment@britishima.org or info@britishima.org. So I'm just going to talk now briefly about this health awareness project and why we're doing this. So the aim of the project is to deliver quality health promotion advice to the community, and these events are open to everyone, whether they are Muslim or non-Muslim. It's about engaging healthcare professionals with their teams and inspiring them and giving them the tools to serve their community. We want to create awareness amongst the general public and hard-to-reach areas in a unified manner across the country. We want to empower patients with knowledge and healthcare professionals also to learn and benefit from the important topics, and hopefully patients can learn the importance of improving their own health. Cancer can be fatal, and creating awareness can help reduce or prevent hopefully some of the common cancers by adhering to these national screening programs which are available free of charge in this country. The other programs that we intend to do this year will be on diabetes just before Ramadan, safer fasting in Ramadan, and that will be in April, and then depression in July. So again, there will be similar formats. So those who want to register for them, please do so by contacting us. This is also an opportunity for the general public to ask questions, the congregation, and speak to professionals, again free of charge. These events are all free. And learn about common problems and improve your own health and the health of the population. So I'll move on to the next slide now. Just an important reminder, the importance of health. So believers in Islam must take care of their spiritual, emotional and physical health. Our bodies, the most complex machines, are given to us by God as a trust. They should not be abused or neglected, but maintained in good order. Diet and nutrition play a big part in maintaining the best possible health. So does a lifestyle incorporating exercise. Islam lays emphasis on a simple diet combined with physical exercise. This is the importance of health in Islam. Now move on to the next part, which is my final part, which is just general tips on presenting this presentation. These talks will be delivered by healthcare professionals who will have a doctor at least of a level of Foundation Year 2 present during these presentations. The talks should be promoted in the localities well in advance. So before you deliver these sessions, just ensure that you've liaised with the local Moscow Community Centre to ensure that they've been promoted by announcements at regular Friday prayers or by having posters, flyers, or on social media. Any photos that you take or media presence as such, please do forward it on to us so we can hopefully compile the results of all these presentations and compile a report at the end. And please do bear in mind these events are open to everyone, whether they are Muslim or non-Muslim. Please encourage everyone to attend to hopefully benefit and improve their own health. Now, just some general tips around the presentation. So please ensure that you have an AV system that's running at the center. Ensure that there's a projector available for you on the day. Ensure that you have a laptop or the center provides a laptop. Again, always take your own just in case there's any technical issues. Have a USB stick again with a backup of the presentation, a pointing device or a remote that you can use for your presentation. And always make sure that before you start promoting them that you've had permission from the center, really important. Then the imam or the committee members to announce before at the mosque before the session takes place so that people are aware and people do remain behind. And sometimes it's better to do it after a prayer because you'll have more people attending after a prayer and then hopefully you can do the presentation straight after. Part of general housekeeping rules, it's important to mention the toilet areas and fire exits. And at the start, it's always worthwhile mentioning that any questions can they either ask at the end. If there's anything they don't understand, then they can ask during the presentation. But please, can they keep the questions relevant to the topic and no personal questions? This can sometimes be a distraction, and sometimes it can cause other people who are not really interested in learning about other people's personal problems. So please do encourage this and make sure you announce this at the start. The duration is for this presentation shouldn't be more than about 40 minutes. And the intention is for this to be interactive. And you'll find there'll be some questions during this presentation where you have an opportunity to ask people. And if the general crowd want to, or congregation want to answer the questions, if not, you can provide the answers. And it's just to keep them more engaged. This talk is in conjunction with Cancer Research UK, who have helped with the preparation of most of the presentation. And there's a disclaimer at the start of this presentation, and it's important either reading this disclaimer or leaving it on the screen for maybe 30 seconds to a minute for people to read through. It's important to mention the objectives of this session and what the attendees can expect to learn from this session at the onset. And again, this is part of the presentation. The presentation starts with a brief introduction on cancer and also a link of the different cancers with diet and lifestyle advice. And this is just a general starter for the presentation to introduce some of the areas that patients may not already be aware of. Start with an introduction of what screening is and emphasize that to the congregation that it's not, this screening program is actually for people who are well. And if you have symptoms, and this is something that you need to really emphasize, that if patients have symptoms, then they must go to their doctor. It's not, if you've got symptoms, you don't wait for a cancer screening, and maybe emphasize that as you go through the different screening programs. There are 3 programs in the UK, and the main focus of this session will be bowel, with a shorter discussion on breast and cervical cancer screening. There are questions that you may want to ask, and as I mentioned earlier, just to make it more interactive. Emphasize again about the screening, that there's different results, the outcomes, what the possible outcomes could be for screening. And again, these are part of the presentation, so do emphasize this. And this will be discussed for all 3 types of screening. Remember, and you can emphasize, screening saves lives. And this is mentioned in the Quran. About saving one life is as if you have saved the whole of humanity or the whole of mankind. So this is the important. And this screening programs, or these different screening programs, can actually help save lives. So when people, the general public, are attending, they should know that this is how important it is, learning about these different problems. Now, explain to them what happens to samples and the results and the implications. There's also mention about symptoms and statistics, and again, briefly mentioned that as well. Move on to the cervical screening and then the breast screening again with similar details. I sometimes, when I've done this presentation, is to ask patients about the risk that breast cancer can also actually also appear with men as well. And sometimes cervical screening and breast screening is important for men to know as well. They all have women in their houses, and it's important that people are aware that just because it doesn't affect them, it may affect a loved one. There's a hadith, which is a saying of the Prophet, peace be upon him, at the end, emphasizing the importance of health and looking after your own health. And also, finally, just ensure that when you finish this presentation, that you clear up at the end, help keep the centre or the facilities that you've used clean. Thank those who have hosted you, and all the best to everyone. I'd now like to hand over to Marion to continue the presentation, who's from Cancer Research UK. Thank you.
Thank you very much, Shazad, and thanks for inviting us to be part of this webinar to your colleagues as well. Just to give a bit more background, my name is Marion O'Neill and I'm the Regional Manager for Cancer Research UK's Facilitator Programme, and I lead our programmes work in Scotland, Northern Ireland and North East England, and I also lead our programmes work on screening programmes. So just to give you all a bit of a background into Cancer Research UK, our vision is to bring forward a day that all cancers are cured, and to do that we want to accelerate progress in relation to earlier diagnosis of cancer in order to aid cancer survival. Within our organisation we have teams that work with different audiences to achieve that ambition, and the presentation today for BIMA colleagues is a collaboration between our health community engagement team, who work with the public to improve awareness of signs and symptoms, and our team, the Facilitator Programme, which works with health services and health systems to improve cancer outcomes. We are really keen to chat to you about some of the learning that we've got around about the barriers to participation in screening programmes for particular populations, and we can share some of that information to give you a bit of an insight as to why it's important to do community work with particular groups. The presentation really has two main aims. The first is to equip you with the knowledge of the cancer screening programmes to deliver the talks, and then secondly to pick up on some of the points that have already been made about equipping you with top tips on what works well around community engagement. We appreciate, again, there'll be a variable audience in terms of knowledge of cancer and experience of delivering talks, so we'll aim this quite general, so feel free to dip in and out of the slides as you access them to make it more relevant to the presentation in your local area. So we'll cover three sections within the session. The first to pick up a little bit more in terms of the background to cancer screening programmes and some of that information we have around the inequalities. For your population, we'll focus a bit more on the Black, Asian, minority ethnic populations, and then much more practical tools for yourself, tips and key messages about what and how to communicate effectively, just building on what's already been said and being able to signpost you to further sources of support. So firstly, we'll talk a little bit about the cancer screening programmes. Just generally to get us all on the same page of the reality of screening, it is with an asymptomatic population, and in reality, it really acts as a filter. So what we know is most people will pass through with nothing showing up, and that people who might have something wrong will get caught in that filter and will need further tests, but the vast majority won't be diagnosed with cancer. In terms of overall cancer diagnosis statistics, only 6% of cancers on average are diagnosed through the screening programme, so much more are picked up through presentation at GPs, but we know that screening picks up cancers at a much earlier stage. Just a couple of misconceptions to highlight about the cancer screening programmes itself. Cancer screening doesn't identify people who may have a higher risk for another reason, such as family history or exposure to risk factors. It's a population programme, and a normal test result doesn't mean someone is at low risk or no risk of developing cancer. It just means the symptoms aren't there at the time of screening. So focusing on the actual screening programmes themselves, we've got 3 screening programmes across the UK: bowel, breast and cervical or cervical. What we've got here is some slides, and in the presentation deck that Shazad mentioned, we've got slides for each of the devolved nations and England, because the age range and how it operates is slightly different. So we'll run quickly through those for each of the nations. First up is England. So bowel, breast, cervical, the age range is there. So bowel, men and women aged 60 to 74, frequency every 2 years. People over 74 can opt in and request a kit, and currently is the fecal occult blood test kit that they receive in the post. There's also a slightly different test in England, which is a one-off bowel scope test at 55. Breast screening, 50 to 70, every 3 years. Again, an opt-in for those older, and it's through a mammogram. And cervical, you'll be more than familiar as it's run in practice. Women aged 25 to 64, different age range depending, different frequency depending on your age range. So 25 to 49 every 3 years, and 5 years, 50 to 64, and cervical cytology or a smear test in relation to that. In terms of the uptake, there are national standards or targets set for the screening programmes. What's important to emphasise is that we are not meeting any of those targets in any of the nations. So the England statistics are on the slide deck for you just now. So for example, if we look at 2013-14 data, bowel screening uptake was 56.4%. So just over half of those who are eligible are participating. We know that in the mix of those not participating will be some people who have consciously made a decision not to, and that's absolutely fine. But we know that for other people, the information isn't reaching them in an appropriate format, and we really think that's where health professionals have a role to play of giving that information in the right context and the right format to support participation for those who do want to take part in the programme. Moving on to Wales, very similar setup in terms of the 3 screening programmes and the age range. It doesn't have the bowel scope test for bowel screening, but everything else is very similar. And similar story on the next slide in terms of uptake. So very low uptake for all 3 screening programmes. Breast screening is just about there in terms of 70.9, and cervical screening sitting about 77.8% for 2015-16, with the target at 80%. Again, moving on to Northern Ireland, very similar. So 3 tests, 60 to 74, 2 years FOBT for bowel screening, 50 to 70, 3 years for mammography for breast screening, and that same age range change for cervical, 3 years for 25 to 49-year-olds and 5 years for 50 to 64-year-olds. And again, some statistics. It's up to yourself whether you want to use some of these in the presentation. It might be important to show people that you're trying to increase uptake and there's a difficulty with uptake across the screening programmes, so that information is there for you to use as you wish. Moving on to the 4th nation, and Scotland has recently changed quite a few of its screening programmes. So the data is there for you. So for bowel screening, just in November last year there, Scotland moved from the fecal occult blood test, the FOBT, to the FIT, the fecal immunochemical test, and that has just come in. So we don't have data on it yet, but it is seen from tests to be shown to be more effective. The age range is slightly different for bowel screening in Scotland, so it starts at 50 rather than 60 in the other nations, and that largely reflects the fact that bowel cancer is the 3rd most common cancer in Scotland compared to the 4th in the UK. Other point of note is cervical screening in Scotland is now the same as the other nations. That changed in 2016. It was previously set at 20. And there have certainly been questions from younger women and also other charities and other stakeholders as to why it has increased. And there's also been some lobbying in other nations for it to be decreased to 20. Again, just to kind of share some of the information, the evidence that we have at Cancer Research UK, we do know that cervical cancer is actually very rare in women younger than 25. If there are changes in the cervix in younger women, it actually leads to unnecessary treatment because it's actually normal cell changes at that age. And on the balance of risks and benefits, the scientists have said that actually screening younger women leads to more harms than overall benefit. So that's just some of the information as to some of the changes in case any of those questions come up. No surprises across Scotland, still difficulty in meeting those targets. And similarly, when we look at the screening for bowel screening, again, just over half are participating in the programmes. So we have a problem across all of the UK and across the population as a whole, regardless of ethnicity, deprivation. There's a real issue of uptake and people having the right knowledge and awareness. What I want to cover is a little bit about the new FIT test, which has been introduced in Scotland, which is seen to have an impact, particularly on younger men in the age range and in deprivation. So it has been introduced in Scotland. We have got agreement in the other devolved nations, and the other nations, and it's likely that it'll be England, then Wales, then Northern Ireland that will follow, because the evidence is quite strong, but they're just reviewing the process and the modelling to introduce it. So FIT is another fecal occult blood test, but it uses human haemoglobin, which makes it quite different from the FOB test. And it's a quantitative test, so people will actually get a number rather than relying on a subjective review of a colour change of the guaiac, which is in the fecal occult blood test at the moment. The next slide just talks you through some of those benefits, just for your own knowledge. As I said, it detects human haemoglobin. It is a more effective test in terms of its pickup rate. There's scope to change the thresholds in terms of the sensitivity to pick up more cancers and refer people through. The big benefit for us in terms of patient engagement is it's a single sample rather than 3 rounds of samples, which is used for FOBT. And for these reasons, we do think there is real potential to see improved uptake with its introduction across all nations. Some of you may also be in areas where the fecal immunochemical test has been talked about for symptomatic patients, so those that are turning up with symptoms. And we wanted just to kind of give some information on the difference between screening for, FIT for screening and FIT for symptomatic. So FIT has been approved for screening with an asymptomatic population, so those that don't currently have any symptoms. But what we're really keen to emphasise, as I said at the beginning, is a negative screening test shouldn't be used as a guide for the investigation of a symptomatic patient. So it may be they're screened in the April and it's negative, they come to you in the June. We shouldn't be using that as a guide because it might be the blood wasn't detected there. And if people present symptomatic, then we absolutely act on that. And we know from some studies in Scotland that a lot of interval cancers, so those that come up in between screening rounds, are actually those that are in the screening age range. So it's important to be aware of symptoms out with that. For symptomatic, there is an evidence there that FIT could be helpful to triage patients through to secondary care in terms of access to colonoscopy, and there are a number of pathways that are being developed in local areas. The important thing for patients is that the threshold, the level that it's set, will be different for screening and symptomatic, and the test may be slightly different as well. So for those that have symptomatic in areas, particularly in Scotland where you now have screening FIT, just being aware of some of those differences. So as we know that will increase uptake, but what we know with FOBT across the UK at the moment is there are inequalities in screening uptake, and there are inequalities generally in relation to cancer. What we've got here is just some statistics for some Black African women and some Black ethnic groups. When we compare to white groups, in terms of the 3 most common cancers, diagnostic outcomes are worse for certain ethnic minority groups. We will caveat that with the fact that there's limited data on ethnicity within practices and being able to pull that out. But what we do know is the stats say there is Black African women are twice as likely to be diagnosed at a later stage with breast cancer, and also at a later stage with bowel cancer. So that's important, again, as we said at the beginning, that screening programs can pick up cancer at an earlier stage. So it's really important that we try and encourage those populations to participate in the screening programs. Again, just an example to give you a further breakdown in relation to those not participating in cervical screening by ethnic group. We've got the different groups of Black, Asian minority ethnic in comparison to white British across there. And we can see that in particular, Bangladeshi women are most likely not to participate. So again, it's thinking about particular populations and what some of the barriers might be for them. In this study presented here, some of the information we got through was round about an overseas birthplace, and just an understanding and perception of how the programmes operate. So summarising some of those barriers to participation generally for cancer screening in relation to ethnicity, there's an issue about people understanding and having awareness of the programme. They don't know it exists, or they might have misconceptions of what the test is. So often we hear that people think cervical screening is a test for sexually transmitted infections or general health as opposed to cancer. An issue with ghost patients in practices. So as I said, South Asian women had a lower uptake of cervical, and a lot of that predictor of lack of uptake was actually an overseas birthplace. So they may revisit their home country for extended periods and not receive the invites. Absolutely language barriers, and there is something about the information that comes out to patients to being in an accessible format, so that the lack of translating materials or inaccurate translation, but also that some people might have poorer levels of literacy in their own language as well. And again, some of them systems, so people understanding and perception of low risk or no risk around about being sexually active for cervical screening, distrust of healthcare system or lack of appropriate healthcare systems, and religious belief and some family issues there as well in terms of ethnicity. Just to give a more general finding across other population groups where we see low uptake in screening programmes, we've talked a bit about ethnicity. I said for bowel screening at the moment, we see particularly low uptake with younger men and low uptake with disability groups as well. Cervical screening, deprivation, ethnicity, disability, and lesbian, gay, bisexual, transgender, and queer groups, and similar ones across that for breast screening. So there are common groups there that we know aren't participating. What's important for us as health professionals and people working in the health systems is to be aware of what are those barriers that we can reduce. Is it access issues? Is it understanding? And I really think some of these talks in the MOS and community groups can really address some of those issues and barriers. Just to quickly pick up on the deprivation, so this is looking particularly at bowel screening. And just a quick visual representation of the impact of deprivation. So for those in the most deprived, we see the percentage uptake lower than half. So when we look at the average, it gives us that above half, but actually when we look at the quintiles of deprivation, there's a real issue for people in deprived areas accessing screening programmes too. And again, we've just listed there some of the common barriers for screening for those in deprived populations, because some of you may be working with those populations as well. So some of the practical barriers, misunderstanding, embarrassment, but actually if you're then getting referred to secondary care for further tests, actually being able to travel and access those services can be a real barrier as well. So obviously the talk today is aimed at BIMA members, and it's looking at those working with people in the MOS and your community groups and your congregations, but we would urge you to think about within that population, are there subpopulations? So we know that there are a lot of excess deaths and poorer cancer outcomes with those living in areas of deprivation, and think about, are there particular subpopulations or those that come to MOS or community venues that you can target that may also be living in deprived areas. So that's really the first section, which is looking at giving you the knowledge in terms of screening programmes. As we've got some more information that you can look at and share with the presentation itself, but hopefully that gives you a bit of a grounding of how the programmes operate and why we think it's important to target particular groups and what some of the barriers might be to participation. What we'll move on to now is just some of the top tips for engaging community events, and this is more about trying to provide you with some practical support building on what Shazad said earlier in terms of the sessions. So firstly, he picked up on the session promotion, and just 3 key tips for you here is thinking about how will you promote it. Some of you may already be running existing education sessions and it's part of a suite and you have some of the promotional activity already covered, but just worth flagging for those who might be running this activity as a standalone session. So thinking about how you can hook people into the session. So where can you promote it in advance? So if it is at Friday prayers, can you ask the imam to raise it the Friday before to get that hook and get people to come back? Are there local community groups it'd be worthwhile promoting it to? Flyers, so how can you use local colleagues in your CCGs, your health boards, or through the Cancer Research UK facilitator teams to get that information out to more community groups? And also consider who are the local advocates. What works really strongly, and particularly with Black, Asian, minority ethnic populations in terms of evidence, is getting local advocates involved. So who else is in the area that can speak the relevant language, can chat to people, just to give them more of that confidence and credibility that it's somebody from the local community. The next slide focuses on session content. So very similar to what we've covered today, a little bit about the background to the cancer screening programme. So who's eligible, what the test is, how often you need to do it. And then a lot around about the practical information, and this will really help to address the barriers we mentioned earlier. So how do you do it? What are the steps involved? And then the third aspect that's really important in any presentation or engagement with the community you're looking at is those key messages. So for us, there's 3 key messages to try and get across within any presentation or information session you're doing around about cancer screening. The first is really emphasising that if it's picked up through screening, cancer does tend to be diagnosed earlier, and depending on disease, it tends to present preferable treatment options and can really improve cancer outcomes for people. The second really important point is at Cancer Research UK, we are strong advocates of informed decision making. We see our role as health professionals to equip our patients with the knowledge and information to allow them to come to a decision about whether to participate. So as I said earlier, for some patients, that's about putting the information in the right context or the right framework or format for them, but being able to remove some of the barriers for them if it's the way the programme operates. And thirdly, again, coming back to some of those barriers, is being aware about some of the misperceptions of who should participate, and the kind of key message for us is really getting that out about it being a programme that's for a well population. It's not for those with current symptoms, so it's an asymptomatic population. In terms of session delivery, you'll probably have your own experience around about this, but some key pointers from us. No surprises, keep things simple. Try not to give people too much information. So try and think of 3 or 4 key messages that you want to have during the session, and think about the time that you've got. If it's a smaller session, you might want to focus on just one of the screening programmes. You might want to cover 3 because it's the only time you're going to get there. But if you're covering 3, you might want less information and have more resources there for people to take away and digest in their own time. Crucial, we would emphasise the point that Shazad made earlier, is about signposting people to their own GP. So being upfront and direct to say that you're not there to answer individual queries, and the person that can help the most is their GP. So if there's any particular individual questions about personal circumstances, absolutely it's about going to the GP as a source of support, because you don't want to have lots of questions coming when you don't know about the individual circumstances. So that's there, and also the Cancer Research UK, we have a website and a nurse helpline if people want to talk to somebody who's separate from any of their other healthcare services, and a bit more confidential. Again, we would emphasise for it to be as interactive as possible. So we have got sample slide deck with presentations which has got some quizzes and questions. Again, that might be or not be appropriate depending on what your context is and where you're presenting, but it's helpful to give people the chance to ask questions and dispel some of the myths that we've talked about, and also think about some of the props. So if you want to talk about bowel screening, you may want to have an FOBT as a demo kit so that people can see it, and in terms of knowing how to do it. Again, with cervical screening, depending on the group you're using, and it may be culturally sensitive or insensitive, having some of the examples of some of the equipment for cervical cytology. So think about where you can make it a bit more interactive for people to see. Moving on, just in terms of the final section is round about some of the additional resources and support. So we're really pleased we've been invited to take part in this webinar, and what we've tried to do is develop some very specific resources tailored to you to support you in the delivery of sessions in your local area on cancer screening. So what we have got is a standardised slide deck which covers those 3 areas in terms of the screening programme, some of the barriers, the benefits of diet and exercise, how they operate, and some of the pros and cons in screening programmes to really give people that informed decision making. So that is there. What we haven't done at the moment is tailored that to a patient or a public audience. So we, as a health professional engagement team, our audience is health professionals, so we'll give you that slide deck at the moment, but we're keen to work with BIMA Future to develop it to be more patient or public or congregation focused, with less text and more infographics. So you may need to adapt and tailor that for your own audience, so that's worth bearing in mind. But we'll come on to some of the slide deck that we've got there. We've also looked at developing some frequently asked questions. So we have experience of delivering to health professionals, to public, and we know some of the common questions that might come up. So we'll hopefully give you some of the answers around about that. A wealth of CRUK patient information leaflets, and we'll come on to a little bit about the facilitator programme as well. So just to run through a couple of those in more detail, as I said, we've developed a slide deck in collaboration with BIMA that at the moment cover all 3 cancer screening programmes and contain some quiz questions. As I said, it's really important that you review those slides and amend for the time that you have and the audience that you have. So again, some of the graphics in terms of some of the actual tests themselves, you might find aren't appropriate for your audience. You might want to focus on one screening programme. And again, you may or may not want to include the information about uptake, and you may or may not want to include other relevant health messages, whether that's religious text, local influencers, it may be local champions, that kind of thing. So to give you an example of that and some of the work that we've done in Oldham, some of the examples of the health messages, some text lifted from the Quran in terms of the importance of cancer, and that idea of prevention and saving lives is there. Again, just some examples of that. So taking advantage of 5 before 5, your youth before your old age, your health before your illness, those kinds of information. That might be helpful to pepper that through the stats and the actual practicalities of how to run the programme. As I said, we've developed a set of frequently asked questions for yourselves as health professionals, just to get your head in the mindset of what questions might come up. I know certainly when I present, whether it's to health professionals or public as an audience, that's the worrying bit, is you're not quite sure what question might come up. So we've got some examples in here So hopefully it'll be a starter for 10. We'd be keen for your feedback on what you're running locally and whether there's other questions that come up and should be in there. So we've got general screening programs. So that idea of no family history, I don't have symptoms, should I participate? Why is it set a particular age range? And why is there no screening programs for other cancers? So some detail in there in terms of Cancer Research UK evidence. And what we've also put into the details which will be circulated with the webinar is some frequently asked questions for the particular screening programme. So a couple of questions on bowel, a couple of questions on breast, and a couple of questions on cervical, if you want to focus on them in particular. We don't plead to say that we have all the answers, but hopefully that will help you in the first instance. And as I said, keen to get feedback from you guys as to whether there's other questions that should be added there. And then finally, just in relation to the Cancer Research UK Facilitator Programme, so the programme that I'm involved in, we work in local areas with health professionals up to the point of diagnosis. So this is one aspect of what we can offer you, and we can help you access resources in terms of the leaflets, NHS leaflets, and also CRUK leaflets in your choice of languages. We also have a team of Cancer Research UK nurses who can come in and work with you in the mosques or community venues. Be aware that they run a programme of activity, so we would need good timings to be able to link you into that. But we've developed a form that you can give us information about what you would like to work, and we can see where we can involve. There are also local community engagement teams, so the bowel cancer screening health improvement practitioners, bowel cancer screening hubs. Your local facilitator team will have good links with them. So if you want to make it a bigger event and not just yourself presenting, we can certainly support you in accessing other staff and capacity to do that. And again, we can support with the local promotion through the networks that we have in your local area. So a lot of support there to help you deliver and also get that message out in terms of the cancer screening programmes. Just a slide there, just in terms as we've developed a form to get information from you about what you are running. If you would like support from Cancer Research UK to support you in a local area delivering your local MOS talk or your community group talk, then please fill in the form and get back in touch with us. Our email address is there. Even if you're not doing a talk but you want to hear more about the facilitator programme or want some information, please get in touch with us and we can direct you to your local facilitator through that email address. And then the final couple of slides is just to give you more information about bowel cancer. So we have the slide deck. You may want more or less information. You may want to just read up yourself on some of the statistics and what works. So we've got particular resources there for bowel cancer. External resources on the next slide in terms of Public Health England resources, NHS choices, and similar ones for breast and cervical. So that's really a kind of snapshot from us. Hopefully that information we've presented to you is helpful. What we hope is to give you a better understanding of how the programmes operate so that you feel confident in standing up to deliver the presentation. Some of it may have been new, it may have been a refresher for you, but also some key tips and hints of how to get the key information across to your patients through community engagement activity. So please get back in touch. That's our contact details if you'd like any support or any work within your practice around about cancer prevention, screening or earlier detection. But good luck and thank you for your commitment to working with us to improve earlier diagnosis of cancer. Thank you.